With my background of funeral service and retail pharmacy, I certainly have a very strong compassion for my fellow man, which is the very reason that I got into this business 26 years ago. I have a passion for the industry and for the clients. The DME providers of North Carolina were the first in the nation to push for licensure in our industry. CMS reports now that there are 38 states requiring oxygen providers to be licensed. The DME industry provides a vital part of care for the individuals in our healthcare system. It's very important to understand that the DME Medicare benefits are less than 2% of the total Medicare budget. Obviously, much of this as a result of small business. There's no debate that our healthcare system is broken and needs major overhaul. Competition in its purest is very, very healthy. Competition keeps businesses honest, service-oriented, and ultimately keeps prices competitive. My impression is that CMS wants to eliminate competition by eliminating DME providers. My company was in the first round of the competitive bidding process. The process in itself was antiquated and very cumbersome, to say the least. We bid for 5 out of the 10 product categories. Fortunately or unfortunately, we didn't win a single product category. The information I received from the bid contractor was that our bid prices were too high. Why? Because I looked at my overhead. I schooled myself very carefully before committing to prices that would create substandard service, poor quality products, and ultimately drive us out of business. There are many troubling issues surrounding the fact that as a stellar organization with a local presence for over 25 years serving the patients would now be unable to continue to serve those patients. The fact that we were told our prices were too high is a clear indication that many suppliers bid to win rather than bid to fulfill the commitment of the bid contract. The DME industry is a service industry. It is not a commodity. It is virtually impossible to place a price or a bid on the value-added services for providing and delivering a hospital bed, setting up oxygen, or sleep apnea machine. I'd like to share a couple of the troubling issues. Many of the bid winners had no physical presence in local communities in Charlotte. CMS awarded these bids to providers that were not even licensed in the state of North Carolina. Inexperienced and undercapitalized companies were awarded winning bids. Several of the winners are less than 2 to 4 years old. They had never done business in the product categories they had won, nor were they licensed and accredited in these winning categories. Many businesses will close their doors. One industry expert calculated that only 9% are going to win the bid. We've heard that already. Approximately 91% of the businesses will go out of businesses. Obviously, this will do away with thousands of jobs in our country. In Charlotte, one product category that equals up to 1,200 jobs. You can multiply that times 10 product categories and 10 MSAs just in the first round alone. To narrow down the results of the competitive bid program for my company, we have eliminated 30% of our staff. That's painful as a business owner. Full-service DME suppliers can traditionally provide all the DME needs of the patient. Items such as wheelchairs, hospital beds, oxygen, mineral nutrients, and walkers may be provided by as many as 5 different suppliers under this plan. How confusing will this be to Medicare beneficiaries, caregivers, and those who facilitate the discharge planning for patients leaving the hospital? Access will certainly be an issue. Case managers have told us they know they can depend on our business because of our service component. Under the Medicare competitive bidding program proposed scheme, the small number of providers will provide substandard service because they will be spread so thin. Patients will suffer, and ultimately there will be a cost shift from paying DME providers to paying for extended hospital stays. Home DME saves the government money. The reality is that my company lost the bid, but truly I have to believe that we were the winner. I'm totally convinced that the number of bid winners are unable to fulfill the commitment, and I feel very strongly that many of the bid winners will not be able to provide the level of care to the Medicare beneficiary. The poor service will cost our healthcare system additional dollars. It will create hospital admissions and ultimately cost the Medicare program higher prices due to the lack of competition. The DME industry is highly regulated, nationally and locally. And obviously, we've already heard, CMS requires that companies be accredited by a certified accrediting agency. In closing, the competitive bidding process is bad policy. It's bad for consumers. It's bad for suppliers. It provides no significant savings to the government. It is inefficient and will ultimately create higher prices. We ask that the Medicare competitive bid implementation be eliminated. At the very least, let's work with the industry insiders to seek alternatives to preserve the program's integrity, maintain beneficiary freedom of choice in the selection of their provider, and ultimately maintain a competitive marketplace that will drive value-added services with competitive pricing. Thank you.